Hey there mamas, and welcome back to my Mommy Glow Up channel. Today I want to talk to you since I am a colonoscopy nurse or a GI nurse. I wanted to help you guys have some do's and don'ts for your colonoscopy prep. We are starting to do our colonoscopy screenings now at the age of 45 here in Illinois, and I think it's around the United States too, but don't quote me on that. For our district, once you reach the age of 45, you are due for your colonoscopy screening. So I've already had a couple of them done. I know what it is, what goes into it, how it tastes. It's bad. You can get through it. Here are some ways to help you get through your first colonoscopy. So here are the do's and the don'ts of your colonoscopy prep. First and foremost, always listen to your doctor's recommendations. If they want you to do something specific, sometimes we do 2 days of clear liquids. Sometimes you take a bottle of magnesium citrate. They have you do some different things. So always follow what your doctor recommends you to do. Like the clinic I work at, these are just some of the things that we're just used to. And I think most facilities around the US will probably follow these as well. So your first do, make sure you're on that clear liquid diet. So on the box of the colon prep, it will tell you that you could have like a light breakfast. At my facility, we do not do that. We recommend that you start on a clear liquid diet as soon as you wake up the morning before your procedure. Only because everybody's different. Some people digest food more slowly, some whip through them and they're fine. But just to better prepare for your colonoscopy, we want to make sure your colon is cleaned out as much as possible. So if you eat breakfast or even a light breakfast, you just run the risk of not being fully cleaned out. So that's why we say as soon as you wake up the day before your procedure, be on a clear liquid diet. What does a clear liquid diet mean? It means, of course, you can have water. I tell my patients, you can also have coffee, just without the cream or dairy products in there to help like cloud things up. Sugar is actually okay because it does melt down. You could have usually like tea, Gatorades, popsicles, Jello, chicken and beef broth, without the noodles or substance in it. It just has to be the liquid portion of it all. You can have any type of pop products, even those darker colas such as Coke and Pepsi, we consider it as a clear liquid. Why is that? I'm not quite sure, but when you put ice cubes in your glass and you pour yourself a nice Pepsi or a Coke, you let it sit for a while, it dilutes down. When you hold it up, you can start seeing through it because it clears up a little bit. So we consider a clear liquid diet. Again, follow your doctor's recommendation though. We do always want our patients to avoid red and purple dyes. Why is that? Because when you have too much red or purple in your food coloring that you're drinking, kind of tint up the colon or make it look red or like something's bleeding in your colon. We do not want to have to decipher if your colon has some bleeding going on or was it just a red Jello you ate the night before. So avoid the red and purple so there's no confusion and you get the best reading on your colonoscopy. Don't complain how hungry you are to the nurses. We get it. We understand. You've been on a liquid diet for a day, day and a half, 2 days, who knows. We understand you're hungry. We want to get you food as fast as possible. When patients come in and say, I'm just so absolutely hungry, it breaks my heart, but it doesn't, because the only thing is I think of like third world countries who are actually starving or people who are not able to buy groceries and can't eat on a daily basis. And then the patients that come in saying how horribly hungry they are or how it's unfair that you can't eat any food. We understand it's a 1-day thing. You can get through it and you are drinking liquids, lots of liquids. I know broth really helped me through my colonoscopy only because it was nice and warm. I thought I'd be drinking a lot more pop because I love my pop, but I didn't. I felt full. Not everybody's going to feel full. I know you're going to be hungry. We get it. The nurses get it. You just don't have to complain to us about how much you hate the process of the colonoscopy. There's nothing we can do to change or fix that for you. I'm sorry, there's not. Another do, make sure you are following your prep instructions as well. We want to make sure you take the full 2 doses of the colon prep. People will say, took the first one, didn't feel like I need to take the second one, and then you're not cleaned out. Take the first one, start taking the second one, and lo and behold, you're nauseated. We get it. Try to push through as much as you can. Hold down as long as you can. I threw up my second dose of the colon prep. I kept it down for an hour. I said, well, that's it. Let it all go. It happens. People get sick. You get sick because you're dehydrated. That's why we say keep up on a lot of fluids. Not only will those fluids help pull into your colon to clean everything out, but it also helps try to get you somewhat hydrated. Now you might notice you get the chills, severe headache, and then the nausea, vomiting. All normal things. Is because we're dehydrating you. And again, keep up on the fluids as much as you can, but follow those prep instructions. Usually we tell you to drink colon prep the night before your procedure. Again, you could keep drinking fluids up until midnight or whatever your doctor tells you to do so. Again, the more fluids you take, the better the prep's gonna work. Key thing, don't take the prep and like, yeah, I took it, I'm fine. We need you to take the fluids in afterwards that it tells you to, because that's what's gonna help clean out your colon. So that's an important step. Also, then we tell our patients to take the second dose of the colon prep, usually about 6 hours before you come in. Now, we do 2 doses. Some people drink a full dose and be done for the rest of the night. Our facility does 2 doses together, one the night before and one the morning of, again, 6 hours prior. That's because overnight things kind of collect on the colon wall while we're sleeping, I believe. So we want you to take that second dose to kind of do another second rinse through, just to make sure everything's getting cleaned out so we are able to see all of your colon walls. So we're not missing any polyps, diverticulosis, redness or irritation or something that could be causing you harm. Now the thing is, a don't with the colon prep. Again, you don't need to tell us nurses how horrible the prep is. We know how bad it is. It's salty, it's gross, it makes you nauseated. It's horrible. It's like giving you a flu bug on purpose. I understand, lots of nurses understand. It gets hard when on a daily basis, almost like 30 patients tell you how horrible this prep is. I will never take it again. I never want to do this the rest of my life. And okay, and that's fine. The thing is too, colonoscopies are usually an elective procedure. So if it's just a screening, your doctor says, yeah, you should have a colonoscopy. Do you have to do it? No, that's your decision. But the downfall is if you don't do it, you get colon cancer and then you're going through chemo for years. You don't catch it in time, it's too late for you already. So why not do a day's worth of horrible prep to make sure you are saving your life and helping your other family members? Because if you have colon cancer, they may have colon cancer as well. So it's a no-brainer for me, but a lot of people just don't want to do it, but run the risk of having a colon cancer. Yeah, I'd rather just take the prep and make sure everything looks okay. So again, it's usually an elective procedure, but would you rather do a colonoscopy and say, you're great, have another colonoscopy in 5 to 10 years? Or have colon cancer and say you need to be on chemo radiation for the rest of the time being, or you may not be able to be saved at all. So it's up to you guys. Colonoscopy, get your colonoscopy. Another major do make sure we as us nurses would call it NPO, meaning nothing by mouth, nothing by your lips, nothing goes in 4 hours before you arrive to your facility. That includes any sips of water, no gums, no mints, nothing to produce saliva, because the more saliva you're producing or you're drinking, it gets into your stomach. And then when you go under sedation, you have the risk of that coming back up and not being able to protect your airway from that gastric juices, I should say. And you have a risk of aspiration. That's why we tell you nothing by mouth for 4 hours before your procedure. So it reduces the risk of aspiration, because we want to protect you at all costs possible. We want to make sure you're okay. We want to do the correct things, healthy, make sure everything is going well. Nothing by mouth, nothing to drink, nothing at all 4 hours prior is a serious risk. So don't do lying to your nurses. Oh yeah, I haven't had anything since after, yesterday morning. It's like, well, did you take the second colon prep? Oh yeah, you're supposed to. It says, make sure you let them know if you had a drink, if you had a sip. I totally forgot I had a sip of this a half an hour ago. Okay, thank you for letting us know. Those aren't the rules. You're not supposed to do that, but now we'll just usually delay your procedure so you have time for that to kind of empty out so you don't have that risk of aspiration. Sometimes we'll cancel the procedure altogether. It just depends on how many cases we have the day, if we could delay you for a few hours and then come back. It all kind of depends on the schedule. So just make sure you have nothing to drink for the 4 hours prior. If you do, something happens, please let us nurses know, the nurse anesthetist know, because it is for your main safety. So don't lie to your nurses about if you had something to drink or not. because it could be a high risk of that aspiration. So a lot of times patients will come in with a bottle of water. Were you drinking the water, or why are you holding this bottle of water? Oh yeah, I was taking sips of it on the way in. Okay, not supposed to do that, but thanks for letting us know, because now we have to let the nurse anesthetist know. And another thing is patients like to do, they tell us nurses one story. I had a sip a half an hour ago. Nurse anesthetist or doctor comes in, oh, I haven't had anything to drink yet today. Like, okay, but you told me us as nurses one story, but you're telling the other head honchos something else. It confuses everybody. Just got to tell the truth, because we don't want to run the risk of aspiration. Us nurses are trying to protect you guys at all costs. Make sure your airway is clear, make sure you're breathing, make sure everything's going well for you. So make sure you do not lie to the nurses. Be truthful. Depending on the doctor's schedule, your procedure could be canceled altogether. So I wouldn't run the risk of taking sips of water or something by mouth, chewing gum to produce that saliva because you're thirsty. We get a lot of patients like, I was just so thirsty, I had to have something. Again, we get it. You're thirsty. You're dehydrated. Of course you're thirsty. You got a dry mouth. We can't have you drinking, taking sips of anything, because again, you're going to be delayed or you may be canceled, and you didn't want to go through all that colon prep just to not have a colonoscopy done and redo the whole thing over again. So just remember, nothing by mouth 4 hours prior to your arrival time to your procedure, and be truthful to your nurses. Now, the only exception to that, I would say, we do have an exception that if you have like heart or blood pressure meds, or I would say if meds that you have to take that morning of the procedure, before your procedure, people are on like anxiety, depression meds, I get it. If you had to take medications, we give you up until 2 hours before you come in to take it with that small sip of water. So let's say you're having a procedure at 8 o'clock in the morning, or you're supposed to be there at 8 o'clock. So we would tell you nothing by mouth at 4 a.m. unless you have heart or blood pressure meds, and you could take that with a small sip of water at 6 o'clock that morning. So again, nothing by mouth after the 4 hours prior to, but a small sip with your medications is okay up until 2 hours before you come in. That's the only exception though. Sorry. Adieu. This was a little bit grosser, but please, if you're able to tell that your stools are coming out like a watery yellow to clear, we want your stools to kind of look like a urine color, because when we're in there, we can suction stuff out. We spray the walls, the colon walls, off with the saline solution. So we got to know, are your stools coming out liquid, yellow, clear, so we can see the bottom of the toilet? Or is your stools coming out like a brown murky and you can't tell anything? Because if that's the case, we may have to do enemas. You may want to do another additional prep of like magnesium citrate. We can help you kind of navigate what else we need you to do to help clear your stools up. But don't tell the nurses that you never look at it. You have no idea what's coming out because you just don't look. Like, who doesn't look? Everybody looks. I feel like everybody should look. Especially with a colonoscopy, we need to know if it's coming out like a urine color, basically. If you tell the nurses, no, I never looked at it, I have no idea. I mean, we're still going to do the procedure. Hopefully you're cleaned out enough, but they may tell you need to come back in 6 months to a year because they didn't get a good look at your colon. So to help prepare you for your colonoscopy, when you're going to the bathroom, give it a little quick peek to make sure you can see the bottom of the toilet, because if you're able to see the bottom of the toilet, you're good to go. We just want the urine color type looking, see the bottom of the toilet, okay, you're fine then. Perfect. One last thing to do to help your colonoscopy, be kind to your nurses. We know this is not a favorable procedure. We know it's uncomfortable, it's embarrassing. Heck, I had my colonoscopy at the facility I work with all my coworkers, friends, and doctors. So yeah, it's embarrassing. I get it. But try to be nice to your nurses, because we're there to help you. Be so hangry. I know you're hungry. I know it's not comfortable. You're having abdominal pain. Your rectum hurts from wiping so much. I get it. Been there, done that. Nobody wants to be there for a colonoscopy. Nobody's going to raise their hand like, I can't wait to have my next colonoscopy. We get it. It's not fun. But the meaner you are to your nurses, the more we may, I want to say, react. We're going to still take care of all of our patients the same. We try to do our best. It just kind of is like a Debbie Downer on us, I guess, that, we want to make sure everybody is comfortable, make sure everyone is getting the answers that they need that day. We want to make sure we're taking good care of you. And it's just hard when you have so many negativities working against you. It starts to break you down a little bit. You get a little burnt out of the situations. It's usually the same story, same jokes, same complaints. The prep is horrible. I'll never take this again. Why don't you come up with a better way? Believe me, if us nurses could, or doctors could even think of a better way to take the colon prep, I mean, I would do it in a heartbeat. We'd be millionaires. They have tablets now, but even those tablets are 24 tablets to take, horse pills, which I mean, I couldn't do it because I can't take pills in the first place. But people say it makes them even more sick, and it's worse than drinking the colon prep. There's no happy way to get around this. You're just going to have to bite the bullet and do it. Again, if you elect to do it. So yes, colonoscopies can help decrease the risk of colon cancer. When you have your colonoscopy, if they find any polyps, which lots of people have, it's not abnormal, they automatically remove those polyps, send it out to pathology. They'll call you, let you know if it's precancerous or there's nothing to be concerned about. Even with precancerous polyp cells, I mean, it takes several years for those polyps to grow back. I recommend you to come back for another colonoscopy, whether it be like 3 to 5 to 7 years. So again, I would highly recommend a colonoscopy just for your peace of mind. Make sure you don't have colon cancer. If it's an early stage of colon cancer, there's, treatments. Also, if they found colon cancer, you let your family know because they could then have a possibility of having colon cancer themselves. I would definitely recommend to have your colonoscopy done if you're at the age of 45 and older. No, it's not fun to take the prep, and it's not fun going through what you have to go through. But the colonoscopy itself is not that bad. It's the prep that's the worst part of it all. So if you could get through the prep the night before, follow your doctor's recommendations, it's a breeze after that. And then you have your peace of mind and don't have to worry about it for the whatever many years they give you. So I hope these little tips and tricks help. I'm hoping to make another video about how to take the colon prep, some tricks about that as well. So remember, mamas, to love and support one another, help encourage each other too for your colonoscopy, and let me know if there's any other questions I can help with. All right, thanks from this GI nurse. Bye.